It's your favorite nurse, Stephanie, and welcome to Plan Senior Moment. This is the podcast that helps you learn how to keep your parents safe, avoid unnecessary hospitalizations, and support them in aging in place with dignity and confidence. Most of my clients come to me during a time of crisis. Mom's in the hospital, things have changed drastically, and suddenly you're scrambling to come up with a plan of care. But it doesn't have to be that way. With each episode, I'll share real life stories, expert advice, and practical tips so that you can be proactive, not reactive when it comes to senior care. Let's get started. Hello, everyone, and thanks for joining today. I'm very excited about our guest. Today we have with us Jeffery with Jeffery Insurance Agency and one of the owners of Coordinated Care Consultants. That was quite a mouthful. Did I get it right?
Yes.
Okay, wonderful. JJ, you help so many of the businesses here in the Valley, and I've known you for years, and I'm so excited for people to learn about the services, and there's quite a few. So we're going to do just a high-level introduction of each area because we're going to come back later and really do a deep dive into each topic on another episode. Would that be okay?
Absolutely. Absolutely.
All right. Tell us all about yourself and your organization, JJ.
Sure. Stephanie, thank you for having me today. It's a pleasure to be on your show. And thank you, everybody, for listening. My name's Jeffery. I am the president and CEO of Jeffery Insurance Agency and one of the owners of Coordinated Care, as Stephanie mentioned. Jeffery Insurance Agency is a specialized health insurance agency. And unlike many other industry participants, we are local in the Valley. We are family owned, and my wife and I and our staff, we have over 50 years combined experience in the Medicare and healthcare industry. We primarily work with Medicare, but we also have a wonderful array of products for all types of health insurance for under 65, families, even businesses. There are lots of changes with Affordable Care Act going on, and we have opportunities to help people with other services as well besides Affordable Care Act. As far as the Medicare goes, so many seniors, they really do have some struggles understanding the system of Medicare and how also Medicaid works, which is Arizona's access system. And so we take the approach that we try to make it as simple to understand as possible for our clients. And we're also there for them after we assist them, keep them informed monthly with newsletters, annual birthday cards, which is always nice to receive, and our client concierge team. And this is all at no cost to our clients as well. And we can review things such as, what are you paying for your prescription drug costs? Are you paying too much? Your co-pays for your medical services, like your doctor's appointments, and maybe if you went into hospital or if you needed an ambulance, they can get costly. And if you've been on the same coverage for many years, then you may want to get a review of your coverages to see whether they are on a par and up to date in comparison to today's offerings. We do all that at no cost. And I say that again, no cost to you. You won't receive a bill from us, and it's nice to know you've got somebody in the industry that can help. That's a great service that we offer. We also help with understanding the Medicaid program. We can also appoint one of our representatives to help you with an Arizona long-term care application. We have specialists in that. How about if you also are unable to get out of your home and you need to have a mobile primary care provider come and see you? Who do you call? Who do you select? How many of them are there out there? We have an array of mobile providers that we can assign to you, and also at no cost, we can make sure that if your insurance is not accepted by those providers, then if it's an appropriate time of the year, we can review your insurance and walk you through the steps to get you onto a comparable insurance and even help you with lowering those co-pays such as prescription and medical services.
Oh, this is wonderful, JJ. And this is an area where there's so much confusion and frustration for people, not just the seniors that I work with, but people,
Yes.
even young families. You have to have it. You're always looking for the best plan, the best pricing. And I have worked with families, JJ, where literally they have to choose between groceries and paying for their medication copays. And many of the families don't know that they just assume that this is what they get with their insurance. They're really not aware that they can shop around and maybe go to the right pharmacy and have them compare generics for the medications that they're on. So walk us through that because you help families like this all the time that are in this situation.
We do, absolutely. One of the most common items that we come across are those regular monthly prescription copays. Some of your viewers today, or some of the facility owners and managers, may only have some residents, or some of you may be only on one or two generic prescriptions, which sometimes can cost you very little or even zero. But some of you may have a multitude of prescriptions, and they may be what's known as brand name prescriptions, and they can become quite costly. And how about if you've been on the same coverage for so long and additional prescriptions have been added to your resume and you don't know whether you're paying too much for them? And we have so many examples of our clients that have become lifelong members of our family, because it is a family here you become a member of. And I can give you one wonderful example. And this person is on our website in our testimonial page, www.jeffreyinsurance.com. And our dear friend Shay, she was paying over $400 a month for one prescription for 1 month's supply. That's a lot of money when you've retired and you're relying on your Social Security and your savings. So we helped her out and helped her keep her providers that she wanted to keep, and kept all of her local hospitals in network. And once she had her plan change, which we helped her every step of the way, made it so smooth, she called us and left a lovely voicemail on our office phone. And our account manager, Brittany, she said, "You better listen to this, JJ. It's the voicemail." And Shay had walked out of the pharmacy and she was in tears leaving a message. And the message was, "I am not crying in anger. I am crying in joy because I just paid $7 for that same prescription." And so these are the reasons why it's great to work with a knowledgeable representative that specializes in your health coverage options, somebody that's local, somebody that will call you back, somebody that's been doing this for a long time. As I said, we have over 50 years experience in this type of help for seniors, and we are here to help you should you need us.
What a great story. People they really, you just don't know until you're in a situation where you've been prescribed a medication. And I've had patients with medications with $8,000 to $10,000 a month for
Yes.
one. It's outrageous. So these things happen all the time. You talked a little bit earlier about how you help find mobile physicians based on their insurances. I want to dig into that a little bit because when I'm working with my clients and aging in place
Yes.
requires physicians and specialists now to come to them because it's a hardship to get out of the home. One of the first things we have to look at is their insurance, right? Tell us a little bit more about what that process looks like so they can get those services.
Sure, absolutely. If you or a loved one or one of your residents, if you are a facility manager or administrator, is in a situation where you are in need of a mobile provider, or you have a mobile provider that's already coming in and you don't know, one, whether your provider is contracted with your insurance, you also don't know of a mobile provider, or you want to find one just from scratch or find a new one. There are many mobile providers out there, but some of the things you need to consider are: one, are they going to be available in your area? Two, how often are they going to be able to come and see you in their availability? Three, what plans they contract with? And four, which is probably the most important, is what services do they offer? And so some mobile providers, they actually offer other services besides mobile primary care. And you may say, what are those services? How about mobile cardiology? How about mobile nephrology, which is the monitoring of your kidneys? What and the liver? What about eye care? What about psychiatric care? What about wound care? What about podiatry for having those medically necessary trimming of your toenails, keeping your feet healthy, and keeping diabetes at bay? These are just some of the things that we can help coordinate. And not only can we help pull in a mobile primary care provider for you or provider, but also align them with your insurance. But we'll also reach out to that provider and connect them with you. So you will get a phone call and they will be able to come out and do an initial consultation with you, fill out the paperwork, and start providing those wonderful services that work in conjunction with your insurance. And the great thing about this, we can connect you with these people at no cost. So, what I mean by that is, we're not going to charge you for making that connection. And a lot of the time, you will just pay the applicable copays, what type of insurance you have, and we can also help you make sure that you're paying the lowest copays for those valuable services. And a lot of the time, it can be for primary care as low as zero. So please give us a call, shoot us an email. We're here to help you.
Yeah, this is one of the most, it comes up on every family that I work with. We have to look at those insurances. More than likely, things are going to have to be changed when we're going to age in place safely at home, and we need those mobile specialists and providers to come to
Mhm.
them. So it's imperative that one of the first things they do is look at their insurances, call JJ. What do we have? What do we need? What do we need to switch to? And now maybe you can give them a list and connect them with the providers that can come in. These types of things cut down weeks, months of work that the families just, they're working so hard to figure all of this out on their own, but it is complex and it gets
It's
frustrating,
amazing.
and you make call after call and you're waiting for people to call you back, and they're trying to, they have
Mhm.
a job, they've got children of their own, so they're the sandwich generation and they're trying to figure it all out. And that's
Mhm.
what we do, JJ. We figure out what they need, we make it easy. And
Yeah.
that's what I love about your organization, because insurance, you know, I just kind of want to run like my hair's on fire because it's challenging, and
It
you
is.
have to, it changes, everything changes every single year. You need an expert who keeps up with these things, that's knowledgeable and can help you make those decisions that are best for your health and your pocketbook, right?
Yes. I'd love to be able to a little bit about our other company, Coordinated Care Consultants. It's a wonderful company, and for all of you viewers that are facility owners, managers, executive directors, admissions managers in skilled nursing facilities, assisted livings, group homes, a coordinated care consultant was put together and created to be a one-stop resource for assisting you with your residents' health care needs. So consider that you may have a combination of what we call private pays, which are non-Medicaid members or beneficiaries, and then you may have Medicaid beneficiaries, maybe on all tax. Those members all have different needs. They all have different insurances. They all have different benefits that they're eligible for. And so many times I come across and meet with facility owners that don't have the time, even in a small group home with, let's say, 10 beds, to be able to go through and help find out whether there's savings that are available to the residents, but also the group homeowner. You might say, well, what do you mean by that? We want to keep our private pay residents in their savings in their bank as long as possible. And so having somebody review the health coverages and saving on those prescriptions that can really add up can, over time and over years, allow for many more months of private pay payment to a facility before they go on to Medicaid, where the monthly adjustment is typically payment from the state is a little low. Once they go on to all tax, review what the benefits are that are available to those residents, because do you have a contract with Alltex? If you do, which carrier? And if you're trying to get a resident onto Alltex, How do you go about doing that? We can guide you through that. What if you have a resident that has assets and they want to try and keep those assets? We have people that can help you with that application, help keep those assets in the family instead of going to the state at a later time. But most of all, maximize those benefits so that the facility could also benefit too. What do you mean? How about if your residents were all eligible for a monthly allowance for healthy foods and groceries? How about if you, the facility administrator, could work with the family or the member to be able to bring those foods in and help save everybody money? Wonderful things like fresh fruit, vegetables, meat, cold cuts, all those great things, dairy products that are essential for healthy living in your facility. Coordinated care consultants can do that with the primary care that we talked about earlier, all text applications, understanding your medical coverages, and so much more. So consider us a resource. We're here. We can come and do an on site visit with you, have a new admit moving in, if you're a new resident, have us review their coverages, introduce us to the family, extend our services as the services of your facility at no cost to you or to your new resident. It will give your resident and their family a feel of comfort that there is a additional service just beyond what you're going to charge there for room and board. And imagine if we help them save money on those services like the prescriptions and medical coverages. How good would you look as a facility administrator? So visit coordinatedcareconsultants.com and you can always give us a call and we're here to help you.
Oh, this is great because they're so busy just providing the daily care, preparing the meals, and giving them their medications. We can't be an expert in everything, right?
No.
We have to bring in the experts to who can do their thing and
Yes.
benefit the homes and the patients and their families. This is wonderful. Things are expensive. We need our dollars to stretch.
You need a contact. You need somebody that you can call. And we are the people that you can call local here in the area. And as I mentioned earlier, we have over 50 years combined experience in our office on an average business day. And to have that resource in your back pocket, knowing that you're not going to get a bill from us, and know that there is an opportunity to say, I don't know who to get this service, but I'm going to call coordinated care consultants and find out if they can help me, then at least you're on the right track because I have clients that call me and they say, after we've helped them, I'm so glad I spoke to you. I have been absolutely in a gray cloud for weeks, and then somebody gave me your number. Thank you so much. It's our pleasure to help you all.
Okay, we talked about it a little bit. All tax. Arizona long term care insurance. This is a big topic. It comes
Yes,
up
it
with
is.
many of my clients. Some of us will, money's never going to be an issue. But
Yes.
for many of us, we have to think about what happens if I live so long that my money is gone.
Yes.
And
Yeah.
here in Arizona, we have something called Arizona Long Term Care Insurance. And I know there's going to be some changes coming soon.
Yes.
So we're going to just do a little teaser, JJ, because I'd like to have you back and spend the entire episode just talking about Arizona long term care insurance.
Be happy to.
Because this is another one where clients and families have a lot of questions. If you fill it out incorrectly the first time, you get denied, and then you're delayed another 30 to 60 days. So
Yes.
just give us high level, and then we're going to bring you back to talk just about this.
Sure. Statistically, on average, somewhere around 85 to 90% of all first time all text applications are denied. And that is a high percentage. So to have an expert be able to assist you with that application is definitely an advantage. We do have people in our staff that are able to assist you with those and answer questions. They are fee based, but they generally are a lot less than hiring an elder law attorney. And in the long run, the amount of money you'll save is going to be beneficial because that person being on all tax is going to save money rather than you paying the room and board to a facility out of pocket. Another thing that is going to be coming up, and a lot of the facility administrators are probably hearing chatter about it, is that this October there are going to be some carrier changes to the long term care. Last year, I'm sure the administrators and facility owners, were getting letters sent to the residents about selecting another carrier, and then it was put on pause. This was because of some legal issues that came up in the contract awards. Now it seems to have been resolved. And so this October, there are going to be letters going out actually prior to October. And there's going to be a limited time to answer to those letters about the upcoming changes. It's really important that down the line, I'm sure Stephanie's going to schedule another meeting that we can peel back a few more of those details about who the carriers are going to be, what the differences may be, why you may select one carrier than the other, and how coordinated care consultants and Jeffery Insurance can help you make the right choice and recommend the right carrier that works with your facility contracts so that you can continue to provide room and board into the future for your residents.
JJ, this is great. Thank you. And great timing as well. I've been working with a family who their loved one, I began helping them with placement, and it was a challenging placement. And that's why they called me. But I actually had to speak to her case manager. We had to change the insurance because of the issues we were having. And I know it's all because of what you just alluded to. I can't
Mm-hmm.
wait to do a deeper dive into that. And I can't wait to have you back. So, everyone, stay tuned. Next time we're talking all about Arizona long-term care insurance and the changes that are coming down the pike soon by October, unless something changes. JJ, again, what's the best way for our audience to contact your organization for help?
You can give us a call at Jeffery Insurance at 480-489-2937. Again, 480-489-2937. You can visit our website at www.jeffreyinsurance.com. Jeffrey spelled Jeffery. And you can also visit www.coordinatedcareconsultants, plural.com. And if you want to reach the owner of Coordinated Care Consultants, that is my wife, Linda Carter. She has over 35 years experience. And you can reach her at 602-818-9474. Either way, both of us, we can make sure that we give you all the assistance needed, answer your questions, and we can continue to be a resource beyond the call that you may put into us or the email that you may send. And we are here available locally right here in the Valley.
Wonderful, JJ. Thank you so much for taking the time to be here today and
Thank you.
educate the audience about all the things you can help them with. I can't wait for the next episode. So please tune in because it's going to be a good one.
Thank you for having me, Stephanie. Thank you all
You
for
betcha.
watching today.
Thank you.